I'm Harriet Nichols. I'm an advanced clinical practitioner for end of life, working in the community, and my role is a pathways role. So there is some direct clinical contact with it, but there's lots of other aspects to my job as well, strategically, teaching, policy and process, etc. I've used clean language in a few ways, I would say, and one of them I've used it to design a presentation for an interview. So I was created a role, or in fact, I've got enough funding for 3 roles, which was new to the trust, and it was a trial, a test of change. And for those roles, we needed to interview, but I also wanted to get a feel for what they understood about the content of the role, and in doing so, set them a presentation. We wanted to know about advanced care planning and what they thought of it, what they knew about it, how they viewed it. And in doing so, there was a question formulated that I thought that could probably be a bit cleaner and we could get a bit more clarity on their understanding. So we changed the wording. So I changed it to something along the lines of advanced care planning looks like what? It was something like that. And in doing that, we were able to get really strong presentations from them without guiding or leading. I felt, as I said, it didn't lead them down a certain pathway. We were able to really get a feel for what those candidates understood from their own experience and their own research and reading as well, which they'd done around what advanced care planning is, what good advanced care planning looks like, how it might feel, what it looks like, what they might hear if they're doing good advanced care planning. And I think we got that from their presentations by wording the question that way. I use it in teaching. So I do, with colleagues, we've rolled out quite a lot of teaching to the community teams. Again, advanced care planning based and looking at nurse-led TEPs and tender conversations, challenging conversations, communication around end of life. And using the clean language in those sessions has enabled me to unpick what the attendees' concerns are, what they're apprehensive about. And it's also then enabled them to understand what they're worried about and get clarity without, again, me leading. It was a much faster process to getting to the center of what the concerns were or what they were anxious about. And it was preventing me as a teacher from making assumptions and therefore answering what I thought they needed to hear, what I thought their questions were. You probably worried about this, therefore don't because. And it stopped me doing that. And sometimes that would give me a very quick guide to what was happening in the room. And I could therefore change what I was saying or show them something different that would get to the heart of that matter straight away. So I would say it saved time and they came away much more confident.
And so would you recommend Clean to other people in the health service?
I absolutely would. I'd recommend using it with colleagues. I'd recommend using it in, again, teaching situations or seminars, webinars, anything like that, but also directly with patients and with relatives and carers. I've used it in every context and it's just incredibly effective. And it's so person-centered. It's so person-centered because you're finding out what is important to that person, what makes them happy, what makes them sad, what worries them, what is important to them in terms of their health and the wider needs. And again, you're taking out all of your own assumptions in doing that. Just another example that I quite liked, which was talking to a colleague, and she was very distressed about a certain situation at work, and she just needed to be heard, but she was getting more and more agitated. And when I listened, I was able to use clean language to reflect the problem. So I heard what the problem was, and then I repeated it back using a clean language question along the lines of, and when this thing happens, what would you like to happen? And that immediately brought her around to a positive shift. And within a 5-10 minute conversation, she'd come away with her own solution as to what she was going to do to resolve that situation. And she said at the end, I feel so much better now I've come to that. Thank you. So I thought, what a great use.